Seniors, listen closely. Every day, millions of older adults take prescription drugs believing they're protecting their health. But what if I told you that some of the most commonly prescribed medications may be quietly chipping away at your memory, focus, and independence? Shocking new research shows that 9 everyday medications, yes, the ones many seniors take nightly, are strongly linked to rapid cognitive decline and even dementia-like symptoms. In this video, we'll count down the 9 medications that could be stealing your sharpness, explain what science says about their risks, and share safer alternatives your doctor may recommend. Stay tuned. Hashtag one will surprise you the most. Anticholinergics, the silent memory killers. Imagine this. You're at the grocery store, standing in the cereal aisle. You reach for your favorite box, and suddenly, your mind goes blank. You can't remember why you came down this aisle in the first place. Was it cereal? Was it milk? Or was it something completely different? Now, occasional forgetfulness happens to everyone. But what if I told you that some of the pills sitting right now in your medicine cabinet may be making these senior moments far more frequent and far more dangerous? Let's start with one of the most underestimated culprits, anticholinergic drugs. The name might sound complicated, but the reality is simple. They quietly block one of your brain's most important messengers, acetylcholine. Think of acetylcholine as the Wi-Fi signal in your brain. It helps nerve cells talk to each other, storing memories, forming thoughts, and keeping your attention sharp. When that signal is strong, your brain works smoothly. But when anticholinergics block it, your mental Wi-Fi drops to 1 bar. Connections get fuzzy, words slip away, focus weakens, and over time, the damage builds. Why anticholinergics are so dangerous for seniors? Here's the scary part. Seniors are especially vulnerable. As we age, our brain naturally makes less acetylcholine. That means we're already running on a weaker Wi-Fi signal. Add in medications that block it even further, and you're setting the stage for confusion, memory loss, and even rapid dementia-like symptoms. What's worse, these drugs are often prescribed or even bought over the counter for very common issues: bladder leaks, allergies, sleep problems, or even mild depression. So many seniors take them daily without realizing what's happening inside their brain. The science you can trust. Now, this isn't just speculation. Let's look at the evidence. A 2019 study published in JAMA Internal Medicine tracked over 284,000 adults aged 55 and older. The results were shocking. Seniors who took strong anticholinergics for more than 3 years had a 50% higher risk of developing dementia. That's not just a small increase. It's a coin flip. Another study from the University of Washington confirmed it. Long-term use of drugs like diphenhydramine, better known as Benadryl, or oxybutynin raised dementia risk significantly, even when doses were moderate. In plain English, science is telling us these medications don't just cloud your brain for a night. They may reshape it permanently. Common anticholinergics hiding in plain sight. Here's where it gets personal. You might be thinking, well, I don't take anything exotic. I just have a few everyday meds. But here's the list you'll want to check. Bladder-controlled drugs like oxybutynin, ditropan, and toltridine, often given to stop nighttime bathroom trips, but at a huge cost of brain health. Allergy and cold medications, such as diphenhydramine, Benadryl, and chlorpheniramine. Yes, even those pink sleep pills you buy at the pharmacy can dim your memory. Older antidepressants like amitriptyline, still prescribed, but known for heavy anticholinergic effects. Over-the-counter sleep aids, the kind many seniors trust to knock them out, are often just diphenhydramine in disguise. If you've ever thought, it's just over-the-counter, it must be safe, here's your wake-up call. Over-the-counter doesn't always mean harmless. Backhand index pointing right, quick check-in. Have you or someone you know ever used Benadryl to sleep? Type yes in the comments. You'll be shocked how many people are in the same boat. The hidden costs beyond memory. Anticholinergics don't just hurt your memory. They also increase risk of falls, dizziness, constipation, blurred vision, and even urinary retention. Imagine the vicious cycle. You take a pill for bladder leaks, It causes dizziness, you stumble and fall, and suddenly you're facing a hip fracture or a hospital visit. For seniors, one small pill can start a domino effect. Are there safer options? Yes. Here's the good news. Doctors today are aware of these risks, and safer alternatives exist. For bladder control, instead of oxybutynin, newer drugs like mirabegron and Myrbetriq have far fewer brain side effects. For allergies, non-sedating antihistamines like loratadine, Claritin, or cetirizine, Zyrtec are usually safer choices. For depression or nerve pain, newer antidepressants like SSRIs, sertraline, escitalopram, are preferred over old tricyclics. For sleep, lifestyle strategies like sticking to a bedtime routine, limiting caffeine, or using natural melatonin can often work better without sacrificing your brain. But here's the critical rule. Never stop or switch your medication on your own. Always talk with your doctor first. Bring them this information and ask, is there a safer alternative for me? You'll be surprised how many physicians will work with you to lower your risk. Simple action step for you tonight. Take 5 minutes after this video to do a quick medication review. Grab your pill bottles, even the ones on the pharmacy shelf, and look for these names: diphenhydramine, oxybutynin, amitriptyline, chlorpheniramine. If you find them, don't panic. Just make a note and bring it to your doctor on your next visit. That small step could protect years of your memory. Why this matters? Think about it. We spend decades building memories, raising families, celebrating milestones, traveling the world. Why risk losing all that because of a pill meant to stop a runny nose or help you sleep? Knowledge is your shield, and you've just taken the first step. Here's the twist. Anticholinergics are just the beginning. The next drug class on our list is even more alarming because it's prescribed by doctors every single day for anxiety and sleep. And many seniors have no idea about the memory risks. You don't want to miss this. Benzodiazepines, the anxiety pills that cloud your memory. Picture this. You're lying in bed at 2 a.m. Your heart is racing. Your mind won't turn off, and all you want is a little peace. Your doctor once prescribed you a small pill, maybe Xanax, Valium, or Ativan, and within 30 minutes, calm washes over you. Sleep comes quickly. Relief feels almost magical. But what if I told you that this miracle pill could be silently eroding your memory, slowing your brain, and doubling your risk of dementia? Welcome to the hidden dangers of benzodiazepines, one of the most commonly prescribed drug classes for seniors, and one of the most damaging to long-term brain health. Why benzodiazepines are so popular and so risky. Benzodiazepines, often nicknamed benzos, are prescribed for anxiety, panic attacks, muscle spasms, or insomnia. They work by boosting GABA, a calming brain chemical that slows activity in the nervous system. For short-term use, they can feel like a lifesaver, quieting anxious thoughts or helping a restless body finally relax. But here's the catch. When the brain is constantly slowed down, it stops processing and storing memories as efficiently. Imagine recording a TV show on an old VCR, but the tape is running in slow motion. The picture comes out fuzzy, the sound garbled, and you miss half the details. That's what long-term benzo use can do to your memory. The science you need to know. This isn't just theory, it's proven in research. A study published in the British Medical Journal followed more than 1,800 seniors for 7 years. The findings? Long-term benzodiazepine use increased the risk of Alzheimer's disease by up to 51%. Another Harvard review confirmed that seniors who use benzos regularly were twice as likely to develop dementia-like symptoms compared to non-users. And it doesn't stop there. Benzos also increase the risk of falls, daytime sleepiness, slowed reaction times, and even car accidents. For older adults, a single fall can mean months of rehab or even permanent loss of independence. The hidden cycle. Here's what makes benzodiazepines especially dangerous. They create a vicious cycle. Seniors often take them for sleep. But over time, benzos actually disrupt natural sleep cycles, especially REM sleep, which is critical for memory consolidation. You wake up groggy, your brain feels foggy, and you think, I need another pill tonight to sleep better. Night after night, the cycle continues. The more you take, the less your brain remembers. Eventually, You may not realize the pills themselves are the cause of your fading clarity. Common names you'll recognize. Let's get specific. Here are the most common benzodiazepines seniors are prescribed. Alprazolam, Xanax, often given for anxiety or panic. Diazepam, Valium, for muscle spasms or anxiety. Lorazepam, Ativan, frequently prescribed for insomnia. Clonazepam, Klonopin, used for seizures or panic disorder. If you see any of these names in your medicine cabinet, it's time to pause and review them with your doctor. Backhand index pointing right quick engagement check. Have you or a loved one ever been prescribed Xanax or Ativan? Drop a yes in the comments. You'll be surprised how common this is among seniors worldwide. Why seniors are especially vulnerable. You might wonder, younger people take these too. Why are they more dangerous for me? The answer lies in how the body changes with age. Seniors have a slower metabolism, which means these drugs linger longer in the bloodstream. A dose that a younger adult clears in 8 hours may take a senior's body 24 hours or more to process. This leads to drug buildup, causing stronger side effects like confusion, memory blackouts, and daytime drowsiness. Combine that with age-related changes in balance and bone density, and suddenly a small pill at night can raise your risk of falls and fractures dramatically. The safer alternatives. Here's the good news. There's safer ways to handle anxiety and insomnia without sacrificing brain health. For anxiety, doctors often recommend cognitive behavioral therapy, mindfulness practices, or safer medications like SSRIs, sertraline, escitalopram. For sleep problems, non-drug strategies often work wonders. Creating a consistent bedtime routine, reducing caffeine, dimming lights, and even natural melatonin supplements under a doctor's guidance. For muscle pain or spasms, physical therapy and stretching routines can reduce the need for heavy sedation. Remember, it's not about never using these drugs. It's about avoiding long-term, nightly dependence. Benzos are most dangerous when taken daily for months or years. Simple action step for you. Here's what you can do tonight. Make a list of all your current medications. If you spot Xanax, Valium, Ativan, or Klonopin, write them down. Don't panic and don't quit cold turkey. Stopping suddenly can cause withdrawal symptoms. Instead, bring the list to your doctor and ask, do I still need this? Is there a safer option? Many seniors have successfully reduced or stopped benzos with gradual tapers supervised by their physicians. Even cutting your dose slightly can reduce your dementia risk significantly. Why this matters? Think of your brain as a library. Every book is a memory. Your childhood, your friendships, the faces of your grandchildren. Benzodiazepines don't rip the books out all at once, but slowly, quietly, they smudge the ink and blur the pages. By the time you notice, entire chapters may be unreadable. Protecting your memory means protecting your story. And here's the shocking part. Benzodiazepines aren't the only sleep-related drugs with hidden brain risks. In fact, the next category, so-called modern sleeping pills, is prescribed to millions of seniors every year. They promise restful nights, but may secretly sabotage your brain even more than benzos. Stick around. You don't want to miss what's coming up in Section 7. Sleeping pills. The restful night that robs your memory. It's 11:30 p.m. You're tossing and turning, staring at the ceiling. You've already counted the sheep, fluffed the pillow, even sipped warm tea, but sleep refuses to come. In frustration, you reach in the nightstand, pop a small white pill, and within minutes, your eyelids grow heavy. Finally, blissful rest. But here's the hidden truth. That pill you've trusted for sleep may not actually be giving your brain the deep, restorative rest it needs. In fact, some of the most common modern sleeping pills are now linked to weaker memory, slower reaction times, and even a higher risk of dementia. So while you may drift off quickly, your brain may be paying a steep price. The rise of Z drugs. Unlike benzodiazepines, which we just covered, these pills were marketed as a safer, modern alternative. They're often called Z drugs because their names usually start with Z. Zolpidem, Ambien, Zaleplon, Sonata, Esopiclone, Lunesta. Doctors prescribe them to millions of seniors each year for insomnia. On the surface, they seem harmless. They help you fall asleep fast. But the sleep they induce isn't normal, healthy sleep. The science behind the sleep. Here's what most people don't know. Sleep isn't just on or off. It's a complex cycle with stages: light sleep, deep sleep, and REM sleep. REM is where the brain consolidates memories, processes emotions, and sharpens focus the next day. The problem? Z drugs suppress REM sleep. That means your body might feel like it rested, but your brain missed the critical housekeeping it needed overnight. Imagine your computer skipping a software update. You wake up, but the system is still running buggy. That's why so many seniors report brain fog, confusion, and forgetfulness after long-term use. The hard numbers. Let's talk evidence. A study from UC San Francisco found that seniors who use Z drugs long-term had a 79% higher risk of developing dementia compared to those who avoided them. Another review from the Mayo Clinic revealed that even occasional use can increase the risk of falls and hip fractures. A single bad fall can steal seniors' independence forever. And here's the kicker. Many seniors take these pills believing they're safer than older drugs like Valium or Ativan. But in reality, the risks are just as severe, if not worse. The hidden dangers beyond dementia. Sleeping pills don't just affect memory. They can also cause next-day drowsiness. Many seniors describe a hangover effect, making mornings sluggish and increasing accident risk. Slow reaction times. This is especially dangerous for seniors who drive. Reaction delays can mean the difference between braking in time and a serious crash. Create dependence. Over time, your body adapts and the pill becomes less effective. This leads to higher doses and even stronger dependence. Disrupt natural rhythms. Instead of teaching your body how to fall asleep naturally, Z drugs override the system, leaving you relying on them. A relatable story. Let's make this real. Picture Mary, a 72-year-old grandmother. She started taking Ambien occasionally after her husband passed away, just to help her sleep through tough nights. Fast forward 2 years, and she couldn't imagine bedtime without it. But her family began noticing changes. She was more forgetful, repeating questions, and one morning she even forgot how to drive to her daughter's house, a route she had taken for 20 years. Mary's story is not unique. Across the world, thousands of seniors experience similar declines, quietly linked to those harmless sleep aids. Are there safer alternatives? Absolutely. The encouraging news is that there are better, safer ways to restore healthy sleep. Sleep hygiene practices. Go to bed at the same time, keeping the bedroom dark and cool, and limiting screens before bed. Nutrient-based solutions. A warm glass of turmeric milk, magnesium-rich snacks like almonds or tart cherry juice, all shown in studies to improve sleep naturally. Melatonin supplements. Under a doctor's guidance, low-dose melatonin can help reset your sleep cycle without the cognitive side effects of Z drugs. Cognitive behavioral therapy for insomnia. CBTI proven more effective than sleeping pills in the long term, without harmful side effects. These approaches may not knock you out instantly like a pill, but they work with your body, not against it, to restore natural, brain-protective sleep. Action step you can take tonight. Take a look at your prescription list. If you see Zolpidem, Zaleplon, or Esopiclone, highlight them. Don't stop suddenly. That can backfire. Instead, talk to your doctor and ask, can we try tapering down? Are there non-drug strategies I can use? Even a small step, like skipping the pill one night a week or lowering the dose, can make a big difference for your memory and brain health long-term. Why this matters. Sleep is supposed to restore the brain, not damage it. Seniors deserve to wake up refreshed, not foggy. Remember, falling asleep fast is not the same as sleeping well. By protecting your REM sleep, you protect your memories, your independence, and your sharpness for years to come. And here's the shocking twist. Sleeping pills aren't the only everyday meds with hidden brain costs. In fact, the next category is even more surprising, because many seniors use these pills for something as simple as allergies or itching. What you'll learn in Section 6 may completely change how you view over-the-counter medicine. Stay tuned. Strong antihistamines, the allergy pills that steal your memory. It's springtime. You wake up with itchy eyes, a runny nose, and sneezing fits that just won't quit. Or maybe it's summer, and those pesky mosquito bites leave you scratching all night. So, Like millions of other seniors, you reach into the medicine cabinet and grab a familiar little pink pill, Benadryl. Within 30 minutes, the itching fades, your nose clears, and drowsiness sets in. Relief at last. But here's the frightening truth. That same pill you trust for allergy relief, sleep, or even a simple cold may be quietly blocking your brain's memory circuits and raising your risk of dementia. Welcome to the hidden dangers of strong antihistamines. What are antihistamines? Antihistamines are medications that block histamine, the chemical your body releases during allergic reactions. They dry up runny noses, ease sneezing, and calm itching. But here's the catch. Many first-generation antihistamines, like diphenhydramine, Benadryl, and chlorpheniramine, also block acetylcholine, the neurotransmitter your brain needs for memory and learning. Think of acetylcholine as the oil that keeps the gears of your brain turning smoothly. When antihistamines block it, those gears grind and squeak. Over time, they rust, and when that happens, focus, recall, and alertness all decline. The science that should concern you. This isn't just theory. In fact, one of the largest studies ever conducted on medication and dementia risk comes from the University of Washington, which tracked 3,500 seniors for over 7 years. Their findings? Seniors who regularly use strong anticholinergic antihistamines had a 54% higher risk of developing dementia. Even more alarming, the risk wasn't limited to heavy users. Moderate use over time was enough to increase memory problems. The message is clear. Taking these pills occasionally may not seem dangerous, but regular, long-term use can take a serious toll on your brain. Common antihistamines seniors should watch out for. Here's the part that may surprise you. These aren't obscure drugs. They're sitting on pharmacy shelves in every corner store. No prescription needed. Diphenhydramine, Benadryl. Often used for allergies, colds, or even as a sleep aid. Chlorpheniramine, found in many cold and flu combination medicines. Hydroxyzine, Atterix, Vistaril, prescribed for itching, anxiety, or sleep. Dimenhydrinate Dramamine, often used for motion sickness. If you've ever taken nighttime cold or allergy medication, chances are you've used one of these without realizing its hidden impact on memory. Backhand index pointing right engagement hook. Comment below if you've ever reached for Benadryl at night to help you sleep. You might be shocked to learn just how many other seniors have done the same. The hidden side effects beyond memory. Antihistamines don't just affect cognition. They also trigger a range of age-specific problems. Daytime drowsiness, leaving you sluggish and less alert. Dizziness and falls, especially dangerous for seniors with balance issues. Blurred vision, increasing risk of accidents. Constipation and urinary retention, uncomfortable side effects that often get overlooked. Combine these with memory impairment, and suddenly a simple allergy pill becomes a recipe for accidents, confusion, and decline in independence. A relatable story. Meet George, a 68-year-old retired teacher. Every spring, his allergies would flare up, and for years he relied on Benadryl every night. At first, he thought nothing of it. It was just a cheap, easy way to get relief and sleep. But gradually, George's family noticed he was repeating questions, forgetting conversations, and even misplacing his keys daily. After reviewing his medications, his doctor realized the nightly Benadryl was the silent culprit. When George switched to a safer alternative, his mental clarity began to improve within weeks. George's story is one of thousands. The takeaway? Sometimes the medications we consider harmless have the most hidden costs. Safer alternatives for seniors. The good news is that not all antihistamines are dangerous. Newer, second-generation antihistamines are designed to target allergies without crossing into the brain. These include loratadine Claritin, non-sedating and safer for long-term use. Cetirizine Zyrtec, slightly sedating for some people but far less risky than Benadryl. Fexofenadine Allegra, another safer option with minimal brain impact. For seniors dealing with allergies or itching, these newer options are usually much better choices. And for sleep, non-drug strategies or natural remedies, like tart cherry juice, warm milk with turmeric, or relaxation routines, are far gentler on your memory. Simple action step for you. Tonight, open your medicine cabinet and check for these names. diphenhydramine, chlorpheniramine hydroxyzine, dimenhydrinate. If you see them, don't panic, but make a note. Bring that list to your doctor and ask, can we switch me to a safer alternative? That one question could protect years of your brain power. Why this matters. Your memory is not something to gamble with. It's the foundation of your independence. The stories you tell, the lessons you share with loved ones, the recognition in your grandchildren's eyes when you remember their names. No allergy relief is worth losing that. Choosing safer options today is a small change that preserves your clarity tomorrow. And here's the surprising twist. Antihistamines aren't the only class of medications quietly chipping away at memory. In fact, the next group, antipsychotics, are sometimes prescribed to seniors for behavior or sleep, even though they carry black box dementia warnings. What you'll learn in Section 5 will shock you even more. Stay tuned. Antipsychotics. The behavior pills that quietly damage the brain. Imagine this. A senior loved one is pacing the living room late at night, agitated, restless, maybe even raising their voice. The caregiver, often a spouse or adult child, is exhausted and desperate for help. A quick trip to the doctor results in prescription, a pill meant to calm behavior, improve sleep, or reduce aggression. Within hours, the senior is quieter, drowsier, easier to manage. Relief. But here's the dark side. Those same pills, called antipsychotics, may be slowly worsening confusion, raising stroke risk, and even increasing chances of death in seniors with dementia. They're sometimes called chemical restraints, because rather than solving the problem, they simply sedate. And the cost of brain health can be devastating. What are antipsychotics? Antipsychotics are medications originally designed for serious mental illnesses like schizophrenia and bipolar disorder. But in seniors, especially those with dementia, they're often prescribed off-label for agitation, anxiety, insomnia, or behavioral problems. The problem? Seniors with dementia already have vulnerable brains. Adding antipsychotics can make confusion worse, not better. The science you need to know. Research is crystal clear. The U.S. Food and Drug Administration, FDA, issued a black box warning, the strongest warning possible, for all antipsychotics used in elderly patients with dementia. Why? Because studies showed they increase the risk of death by up to 60%. A study in the New England Journal of Medicine followed thousands of nursing home residents prescribed antipsychotics. Results showed higher rates of stroke, heart problems, infections, and rapid cognitive decline. In plain English, while these drugs may calm agitation in the short term, they quietly chip away at overall survival and brain function. Common antipsychotics seniors might be taking. Here are some of the most common names to watch for. Risperidone Risperdal, often used for aggression or agitation. Quetiapine Seroquel, sometimes given for sleep despite risks. Olanzapine Zyprexa, prescribed for behavior changes. Haloperidol Haldol, an older drug, still used in hospitals and nursing homes. If any of these names are on your prescription bottles, or your loved ones, it's time to ask questions. Backhand index pointing right, quick engagement. Have you ever seen a senior prescribe Seroquel or Risperidone for sleep or agitation? Type yes in the comments. If so, you'll be surprised how many families have had this experience. The hidden side effects. Antipsychotics don't just increase dementia risk. They create a cascade of side effects that can drastically reduce quality of life. Sedation and drowsiness, making seniors sleep excessively and lose daytime energy. Worsening confusion. Instead of improving behavior, they often increase disorientation, movement disorders, tremors, stiffness, or shuffling gait, sometimes mistaken for Parkinson's. Falls and fractures. Sedation combined with poor balance is a dangerous mix. Weight gain and diabetes risk, particularly with newer drugs like olanzapine. For many seniors, these side effects create a downhill spiral. Less mobility, more weakness, and greater dependence on others. A story that hits home. Consider Betty, a 75-year-old living with early dementia. She occasionally became agitated in the evenings, pacing and asking the same question over and over. Her overwhelmed family, doctor prescribed quetiapine, Seroquel, to take the edge off. At first, it seemed like a blessing. Betty was calmer, easy to care for, and slept through the night. But within months, her family noticed changes. She was more confused in the mornings, her speech slowed, and she stumbled frequently. One fall landed her in the hospital with a fractured hip. Only later did her daughter learn that Seroquel carried a black box warning for dementia patients. The medication that was supposed to help had actually accelerated her decline. Are there safer alternatives? Yes, thankfully in many cases. Antipsychotics should always be the last resort, not the first option. Safer strategies include non-drug approaches, reducing noise, improving lighting, creating calming routines, or addressing pain and discomfort that may trigger agitation. Safer medications. For anxiety or sleep, low-dose SSRIs, melatonin, or even short-term anxiety therapy may be better options. Caregiver support. Sometimes the best intervention is supporting caregivers with education and respite care so they can manage behavior without resorting to sedation. Action step you can take. If you or a loved one is on an antipsychotic, don't panic and don't stop suddenly. Instead, bring a prescription to your doctor and ask, is this absolutely necessary? Are there safer alternatives we can try first? Many seniors can be tapered off these drugs under supervision, regaining clarity and energy once the sedative fog lifts. Why this matters? Behavioral changes in seniors, especially those with dementia, are difficult and heartbreaking. But we must remember, a calm senior is not always a healthier senior. Sedation may make life easier for caregivers in the short term, but it can steal precious years of memory, mobility, and independence. Every life chapter matters, and no one deserves to have those pages blurred by unnecessary medication. And here's the surprising twist. Antipsychotics are often prescribed by doctors, but the next category of drugs, acid reflux medications, are sold over the counter in every pharmacy. Millions of seniors take them daily for heartburn, not realizing they may quietly be draining the brain of nutrients it desperately needs. You don't want to miss Section 4. Proton pump inhibitors, the heartburn pills that drain your brain. It's 9 p.m. You just finished a delicious dinner, maybe a plate of spicy curry or a late-night slice of pizza. 30 minutes later, the burning starts. That familiar acid reflux climbs up your chest, making you reach for the little purple pill you've trusted for years. Within an hour, the burning fades. Relief. But here's the truth most seniors never hear. The very pills designed to soothe your heartburn, called proton pump inhibitors or PPIs, may be slowly draining your brain of nutrients, raising your dementia risk, and damaging your long-term memory. What are PPIs? PPIs are medications that reduce stomach acid production. Popular names include omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid, pantoprazole, Protonix. They're marketed as safe, effective, and available both by prescription and over-the-counter. Millions of seniors pop them daily, sometimes for years, without realizing the risks. Why stomach acid matters for your brain. Here's what drug ads never explain. Stomach acid isn't just a nuisance, it's essential. Acid breaks down food so your body can absorb vital nutrients like vitamin B12, magnesium, and calcium. Without enough stomach acid, those nutrients slip right through, leaving your brain and body starved. Think of stomach acid as a key that unlocks nutrients from your food. When you take PPIs, you throw away the key. Over time, your body can't absorb enough B12, magnesium, or even iron. The result? Brain fog, memory lapses, nerve problems, and higher risk of dementia. The science that should alarm you. The research here is eye-opening. A 2016 study in JAMA Neurology tracked more than 73,000 seniors. Those who use PPIs regularly were 44% more likely to develop dementia than those who didn't. Another study from Germany, following 3,300 seniors, found that long-term PPI use increased dementia risk by 52%. Even the FDA has issued safety warnings about PPIs, linking them to low magnesium levels, kidney problems, and fractures. In simple terms, while PPIs may calm your stomach, they quietly chip away at your brain and bones. A relatable story. Meet Harold, a 70-year-old retiree. He'd battled acid reflux for years and started taking omeprazole every morning. At first, it was life-changing. No more burning, no more discomfort. But after 3 years, Harold began noticing changes. His memory wasn't as sharp. He forgot appointments, misplaced bills, and even left the stove on one evening. When his doctor ran tests, Harold's B12 levels were dangerously low, despite eating a healthy diet. The culprit? His daily PPI had blocked his body's ability to absorb nutrients. Once his medication was reduced and supplements added, his clarity improved. Harold's story is a warning. Sometimes relief today can cost you tomorrow's memory. The hidden side effects of PPIs. Beyond dementia risk, PPIs carry other dangers often overlooked. Bone fractures. Low calcium absorption weakens bones. Kidney damage. Studies link PPIs to chronic kidney disease. Infections. Reduced acid allows harmful bacteria to thrive. Low magnesium, causing muscle cramps, irregular heartbeat, even seizures. For seniors, these risks stack up quickly. What starts as just heartburn can spiral into a much larger health crisis. Are there safer alternatives? Thankfully, yes. Not all heartburn. Relief requires long-term PPIs. Safer strategies include lifestyle adjustments. Avoid lying down after meals, reduce late-night eating, elevate the head of your bed, and cut back on trigger foods like caffeine, chocolate, or spicy meals. Alternative medications. H2 blockers like famotidine, Pepcid, may provide relief with fewer long-term brain risks. Natural aids. Ginger tea, chamomile, and small evening snacks of oatmeal or bananas can reduce reflux without medication. Medical review. Sometimes reflux stems from hiatal hernia, obesity, or other issues. Treating the root cause may reduce the need for medication altogether. Simple action step for you. Tonight, check your medicine shelf. If you see names like Prilosec, Nexium, Protonix, or Prevacid, ask yourself, how long have I been taking these? If it's been more than a few weeks, make a note and bring it to your doctor. Ask, do I still need this? Are there safer options? Many seniors can reduce their PPI dose or transition to safer alternatives with a doctor's help, protecting both their stomach and their memory. Why this matters. Heartburn is uncomfortable. Yes, but what's more painful is losing your independence because of memory decline, falls, or brain fog caused not by aging, but by medications meant to help. Protecting your brain is worth the effort of asking questions and making adjustments. And here's a surprising twist. PPIs may be hiding in plain sight, but the next group of medications are prescribed to almost every senior at some point, and their effect on memory is highly debated. Some studies show they protect the brain, while others link them to confusion and decline. Section 3 will uncover the truth about statins, the cholesterol drugs millions of seniors take every day. Stay tuned. Statins, the cholesterol pills that spark a memory debate. It's a routine doctor's visit. Your cholesterol is creeping up, your doctor's concerned about heart disease, and before you know it, you leave a prescription in hand. Maybe Lipitor, Crestor, or Zocor. Millions of seniors around the world take these pills every single day. Statins are so common that for many, they feel as normal as brushing your teeth. But here's the question you won't hear on most commercials. Could the same pill that protects your heart also cloud your memory? The answer isn't simple. In fact, statins sit in the middle of one of medicine's biggest debates. Some studies suggest they shield the brain, while others warn they may trigger confusion, brain fog, or even memory loss. Let's dig into the facts. What are statins? Statins are medications that lower cholesterol by blocking an enzyme your liver uses to make it. Lower cholesterol reduces risk of heart attacks and strokes. For seniors, they can be life-saving, especially if you've already had heart disease. But cholesterol isn't all bad. In fact, your brain is the most cholesterol-rich organ in your body. Cholesterol forms the insulation around nerve cells, helping signals travel fast. Without it, memory and focus can stumble. That's why some experts worry. Oversuppressing cholesterol might weaken the brain's communication system. The science, confusing but important. Here's where it gets tricky. A 2015 FDA safety warning admitted that some statin users experience memory loss and confusion, usually reversible after stopping the drug. A 2013 study in the Journal of General Internal Medicine found that seniors on statins reported more fatigue, slower thinking, and increased forgetfulness. On the other hand, a 2019 analysis from Harvard suggested that statins may reduce dementia risk in some patients by protecting blood vessels in the brain. So which is it? Are statins friend or foe? The truth is it depends. Some seniors benefit, others suffer side effects. Genetics, dosage, and other health conditions all play a role. A relatable story. Take Evelyn, a 74-year-old retired librarian. After a mild heart attack, she was prescribed atorvastatin Lipitor. Within months, her cholesterol dropped, but her daughter noticed something else. Evelyn began misplacing her reading glasses, repeating questions, and struggling to recall the names of her favorite authors. At first, they blamed age, but when her doctor reduced her statin dose and added CoQ10, a supplement that supports energy in cells, Evelyn's clarity returned. Her story highlights a key point. Sometimes memory issues aren't from aging, but from the very medications meant to protect you. The hidden side effects of statins. Memory concerns aside, statins can cause other problems that indirectly affect brain health. Muscle pain and weakness, discouraging physical activity, which is crucial for memory and cognition. Fatigue, leaving seniors less engaged and mentally sharp. Sleep disturbances. Poor sleep harms memory consolidation. Blood sugar increases, raising risk for diabetes, another dementia trigger. These side effects don't hit everyone, but when they do, they can quietly erode quality of life. Why seniors are at higher risk? As we age, the brain naturally becomes more sensitive to changes in cholesterol and blood flow. Seniors taking higher doses of statins may tip the balance too far, protecting the heart, but accidentally starving the brain of what it needs for sharp thinking. Think of it like watering a garden. Too much water and the roots drown, too little and the plants wilt. Statins, when overused, may overwater the brain's delicate system. Safer approaches and alternatives. The good news? Statins are not the only answer. Many seniors can reduce their need for high doses or avoid them altogether with lifestyle changes and safer strategies. Dietary changes. A Mediterranean-style diet rich in olive oil, fish, nuts, and leafy greens can lower cholesterol naturally. Exercise. Even 30 minutes of walking most days supports both heart and brain health. Supplements. CoQ10 may reduce statin side effects like fatigue and muscle pain. Dose adjustments. Sometimes a lower dose or switching to a different statin eases memory complaints. The key is balance, protecting the heart without sacrificing the brain. Simple action step for you. If you're taking a statin, ask yourself, have I noticed any new memory lapses, brain fog, or unusual fatigue since starting this medication? If yes, write those down and bring them to your doctor. Ask, could my statin dose be too high? Are there alternatives? Never stop on your own, but do start the conversation. For many seniors, small changes make a huge difference. Why this matters? Your heart and your brain are both priceless. Protecting one at the expense of the other is not true health. Statins may be life-saving, but ignoring their possible cognitive impact can rob you of the very memories that make life worth living. By staying informed and proactive, you can find the balance that keeps both your heart and mind strong. And here's the twist. While statins spark debate, the next category of drugs isn't debated at all. Its dangers are crystal clear. These medications are prescribed for pain, but research shows they can rapidly accelerate memory loss and even trigger dementia-like symptoms. In Section 2, we'll uncover the hidden brain risks of opioid painkillers. Stay tuned. Opioid painkillers, the pain relief trap that clouds a mind. It starts with something simple, a sore back from gardening, a knee aching from years of climbing stairs, or hip pain that won't let you sleep. You see your doctor, and they prescribe something strong, maybe oxycodone, hydrocodone, morphine, or codeine. The relief is almost immediate. The sharp pain fades, your body relaxes, and life feels manageable again. But here's the problem no one tells you at the pharmacy counter. The same opioid pills that quiet your pain can slowly steal your memory, cloud your thinking, and dramatically increase your dementia risk. What feels like a solution today may quietly set you on a dangerous path tomorrow. What are opioids and how do they work? Opioids are powerful painkillers that act directly on the brain. They attach to special receptors, blocking pain signals and triggering a wave of calm, even euphoria. That's why they're so effective and why they're so addictive. But here's the catch. Opioids also slow down brain activity. The same receptors that block pain also dull attention, weaken short-term memory, and interfere with the brain's natural reward system. Over time, this can lead to foggy thinking, forgetfulness, and reduced ability to learn new information. Think of your brain as a radio. When it's tuned properly, every station comes through clear. Opioids don't just turn down the volume of pain. They turn down the whole signal, leaving your memory and focus muffled. The science that should alarm you. Multiple studies confirm the risks. A 2021 study in the Journal of Alzheimer's Disease found that seniors who regularly use opioids had a 30% higher risk of developing dementia compared to non-users. Research from a Mayo Clinic showed that even short-term opioid use in older adults led to measurable declines in attention and memory within weeks. Another study in the U.S. Veterans Affairs System linked long-term opioid therapy to faster cognitive decline and higher risk of brain atrophy. In plain English, the longer seniors take opioids, the greater the chance of memory loss, confusion, and eventual dementia. A relatable story. Consider Robert, a 72-year-old Vietnam veteran with chronic back pain. His doctor prescribed hydrocodone years ago. At first, it was a lifesaver. He could walk, sleep, and enjoy life again. But slowly, his wife noticed changes. Robert repeated stories, misplaced keys, and once forgot to turn off the stove. He shrugged it off as normal aging. When Robert was evaluated, doctors realized his long-term opioid use was contributing to cognitive decline. After tapering his dose and switching to non-opioid pain strategies, Robert's memory and alertness began to improve. His story is a reminder. Not all memory loss is age-related. Sometimes it's medication-induced. The hidden side effects beyond memory. Opioids bring more than just brain risks. For seniors, they create a cascade of other problems. Sedation and drowsiness, raising the risk of falls and injuries. Constipation, a constant struggle for many seniors. Respiratory depression, slowed breathing, dangerous at night. Tolerance and dependence, requiring higher doses over time. Withdrawal symptoms, making it difficult to stop once started. When you add these side effects of memory loss, opioids become one of the most dangerous solutions for chronic pain in seniors. Why seniors are especially vulnerable. The aging brain processes drugs more slowly. What might be a safe dose for a middle-aged adult can linger much longer in a senior system. Combine this with age-related changes in balance, bone strength, and cognition, and opioids become a recipe for accidents, hospital visits, and faster decline. Backhand index pointing right quick engagement. Have you or someone you know ever been prescribed opioids for chronic pain? Drop a yes in the comments. Let's see how common this is in our senior community. Safer alternatives for pain relief. The good news? Pain management doesn't have to mean sacrificing memory. Safer strategies exist. Non-opioid medications, acetaminophen, Tylenol, or certain non-steroidal anti-inflammatories, NSAIDs, may help for some conditions, though always under doctor's supervision. Physical therapy. Gentle stretching, strengthening, and mobility exercises can reduce chronic pain at its root. Natural approaches. Turmeric, omega-3 fatty acids, and anti-inflammatory diets have been shown to ease joint and muscle pain. Mind-body techniques. Meditation, deep breathing, and guided relaxation lower pain perception without drugs. Topical treatments. Capsaicin creams or lidocaine patches target pain locally without fogging the brain. Simple action step for you. Tonight, take a look at your medications. If you see names like oxycodone, hydrocodone, morphine, or codeine, write them down. Then ask yourself, do I still need this daily? Are there alternatives I could try? At your next doctor's visit, bring it up. Ask, can we lower my dose or try a non-opioid option? Many seniors are surprised to learn they can manage pain just as effectively with safer strategies while protecting their brain. Why this matters. Pain steals joy, but losing your memory steals your independence. Opioids may bring short-term comfort, but at the cost of your clarity, safety, and long-term well-being. Your memories, the laughter, the family milestones, the wisdom you've gathered, are worth far more than temporary relief. Protecting them should always come first. And here's the most shocking part. While opioids are dangerous, the final medication on our list is even more surprising. These are drugs meant to lift mood and ease depression. Yet some of them carry one of the strongest links to dementia of all. In Section 1, we'll reveal the antidepressants most seniors should avoid and which safer options exist. You don't want to miss it. Antidepressants, the mood lifters that can quietly dim your memory. Imagine this. You're sitting at the breakfast table. The sun is shining, but you feel heavy inside, sadness, anxiety, maybe even hopelessness. Your doctor prescribes an antidepressant, promising it will help you feel like yourself again. And at first, it does. The cloud lifts, your mood improves, and daily life feels manageable once more. But here's the shocking truth few seniors hear. Some antidepressants, especially older ones, carry powerful side effects that can block memory, increase confusion, and even raise dementia risk. For seniors, these mood lifters may also quietly dim the very clarity that keeps you independent, which antidepressants are risky. There are many types, but two stand out for their impact on memory. Tricyclic antidepressants, TCAs, older drugs like amitriptyline, imipramine, and nortriptyline. These are strongly anticholinergic, meaning they block acetylcholine, the brain's memory messenger. The result? Foggy thinking, slower recall, and higher dementia risk. Certain SSRIs, selective serotonin reuptake inhibitors. While most SSRIs are safer, paroxetine Paxil is an exception. It also blocks acetylcholine, creating similar memory problems. Backhand index pointing right engagement cue. Comment yes if you've ever heard of Paxil or amitriptyline. You'll be surprised how many seniors still take them daily. The science you need to know. Research has been sounding the alarm for years. A 2015 study in JAMA Internal Medicine found that seniors taking strong anticholinergic antidepressants had a 54% higher risk of developing dementia. Another long-term study from the University of East Anglia revealed that memory problems often begin within the first year of use and worsen with continued exposure. Even the American Geriatric Society includes TCAs and paroxetine on their Beers criteria list, drugs considered unsafe for seniors due to their cognitive risks. In plain English, these antidepressants don't just ease sadness, they may also erase memories. A relatable story. Meet Linda, a 69-year-old grandmother. After losing her husband, she struggled with depression and trouble sleeping. Her doctor prescribed amitriptyline, an older antidepressant. At first, it helped. She slept better and felt calmer. But within months, her daughter noticed changes. Linda repeated herself, forgot where she put her wallet, and once got lost driving to the grocery store. At first, everyone blamed grief. But when her doctor switched her to a newer, safer antidepressant, Linda's memory began to improve. Her story shows a hidden risk. Sometimes it's not aging or sadness stealing memory. It's the pill prescribed to treat it. The hidden side effects beyond memory. Antidepressants, especially older ones, bring other issues too. Drowsiness and falls. Dangers for seniors with balance challenges. Blurred vision and constipation. Common anticholinergic effects. Weight gain and diabetes risk, especially concerning for long-term users. Drug interactions. Antidepressants can interfere with heart medications, blood thinners, or even painkillers, creating a risky cocktail. For seniors managing multiple prescriptions, these risks stack up quickly. Safer options exist. Thankfully, not all antidepressants are harmful to memory. Safer choices include SSRIs like sertraline, Zoloft, or escitalopram, Lexapro, widely used and safer for older adults. SNRIs like duloxetine, Cymbalta, effective for both depression and chronic pain. Non-drug strategies, counseling, support groups, light therapy, daily exercise, and a Mediterranean-style diet are all proven to improve mood without harming memory. The key is personalized care. What works for one person may not work for another. But the good news is that safer, memory-friendly options exist. Simple action step for you. If you or a loved one takes antidepressants, check the label. Look for names like amitriptyline, imipramine, nortriptyline, or paroxetine Paxil. If you see them, don't panic. But do make a note at your next appointment. Ask your doctor, is this the safest option for me? Are there alternatives with fewer memory side effects? Never stop suddenly. Antidepressants must be tapered carefully, but always start the conversation. Protecting your brain is worth it. Why this matters? Depression is serious. No senior should suffer in silence. But the solution should never come at the cost of memory. Losing joy is painful, but losing yourself, your independence, and your memories is devastating. By asking the right questions and exploring safer options, seniors can protect both mood and mind. And here's the powerful takeaway. The 9 medications we've covered, from antihistamines to antidepressants, may seem unrelated, but together they highlight one truth. Not every prescription is senior-friendly. In the final outro, we'll tie it all together, giving you one simple action step you can take tonight to protect your memory and your independence for years to come. Your memory is not just about remembering names or dates. It's a thread that connects your entire life story. It holds the laughter of your grandchildren, the milestones you've achieved, and the wisdom you've gathered over decades. The truth is, many seniors unknowingly risk losing that precious clarity, not because of age alone, but because of the medications sitting in their cabinets. Now that you know the 9 common drugs that may trigger rapid dementia, you have the power to act. Don't stop or change anything suddenly, but do start a conversation with your doctor. Ask, is this the safest option for my memory? That one question could protect years of independence, strength, and joy. If this video helped you, please tap like so more seniors find it. Hit subscribe and the notification bell for weekly science-based health tips, and share this with a friend or family member. It might save their memory too. And in the comments, tell us, which of these medications surprised you the most? Your story could help another senior take their first step toward protecting their brain. Remember, every choice matters, every conversation matters, and every day you have the power to protect your health, your independence, and your future.